Kiminini Cottage Mission Hospital, located in Kiminini Town, Trans Nzoia County, is a faith-based Level 4 hospital under the Catholic Diocese of Kitale. The medical center has gradually transformed, rising through ranks from a dispensary to a Level 4 referral hospital.
So Kiminini Cottage Mission Hospital started way back in 1950s as a dispensary. The reason why this dispensary was started, it was because there were no hospitals around Kiminini and most of the patients needed to travel up to Kitale to get attended to. So this facility was started to take care of the health needs of the people who live around Kiminini and beyond.
The hospital was founded with the main aim anchored on participating in the healing ministry of Christ through provision of top-notch 24-hour preventive, rehabilitative and promotive care to the needy.
In this we strive to share in the healing ministry of Christ, where he served the sick.
The facility is strategically situated in Kiminini Town.
Kiminini Cottage Mission Hospital is located along Kitale-Webuye Highway at Kiminini Market next to St. Peter Claver Catholic Church, Kitale.
Kiminini Cottage Hospital offers 24-hour inpatient and outpatient healthcare services.
We assess if the patient is severe, we attend them on first contact based on their severity, and most of the emergencies that come here, we attend them all with, but a few we refer, which are beyond our help.
In inpatient, we also have a private ward, an amenity, which is still new, and we encourage people to use it. We have a laboratory in the facility, and we do a variety of tests, both routine and special tests.
The laboratory is sufficiently equipped Class E referral lab with online systems to efficiently expedite testing and processing of specimens.
We perform a series of tests. We have the routine tests, have the special tests, and we are also a referral lab. For the patients, we have a turnaround time. We have the hospital management system, whereby we receive the patient through the system, we process the samples, and we dispatch the results through the system, and it takes the minimum time possible. In this lab, we also have the fully automated machines. We have the iChroma, we have the alcohol for performance of the biochemistry tests, and soon we will be starting our culture. We also have a gene expert, whereby we receive samples from the referral sites and we process them, and we give them the results within the shortest time possible through the system.
The laboratory operates on a 24-hour basis with a dedicated team of technologists working round the clock.
In case of emergencies, then we get called, then we attend to the patient immediately.
The hospital management is focused on ongoing capacity building to be able to accommodate and attend to more patients efficiently.
In the inpatient, we have a total bed capacity of 60, which is inclusive of the pediatrics, male ward, female ward, and an acute room. So for the acute room, this is where we place patients who need close monitoring. For example, patients who need oxygen therapy, and we need to monitor them closely, like maybe half-hourly or after every 15 minutes, and maybe those clients who have high blood pressure who also need close monitoring.
For those who are stable, we can allow them to go home after 3 days of treatment. But for those who are very ill, we maintain them here for at least a week, getting proper treatment. Most of these patients, when they come here, they pass through our patient clinic. That's the OPD. So for those who meet the criteria for admission, mostly we bring them to the wards. But if they don't meet the indication for admission, we manage them as outpatient department, OPD. Then they go home, they get their medication. They're seen mostly by the doctors, the clinical officers, sometimes also the medical officers. We see the patients from there, then they go home.
The radiology department is well equipped with modern imaging equipment to provide timely and efficient X-rays, CT scan and ultrasound services.
We offer obstetric ultrasound, normal ultrasound, abdominal, and in obstetrics also we have the Doppler ultrasound we are offering at our place. We ensure patient safety here. We make sure that infection prevention is our first priority to avoid transforming infection from our department to other, or carrying infection from the other department to our department. So that's our top priority, and we make sure we give best and quality radiology services to all our patients with equality, without biasness. We make sure that there is high efficiency in our work, and we are confident in whatever we are doing because we believe in ourselves, and we put our patient first in everything that we're doing, and we are time conscious.
Our certified dental department provides preventive, diagnostic and therapeutic care to patients with oral system medical complications.
We offer a wide range of services. We focus specifically on the well-being of the patient. It's not just limited to the mouth. We look at the general well-being of the patient. The well-being of the patient always starts with the mouth. We do dental extractions, permanent fillings, temporary fillings, teeth replacement, realignment, we call them braces. We also focus on prevention. We educate patients about how we can prevent various dental problems. We make sure the patient is comfortable. Once we consider the comfortability of the patient, we consider the well-being of the patient. That in the long run, our main goal is to ensure that the patient is okay. The patient is not in pain. The patient, we restore the smile in the long run.
The maternity wing comprises of antenatal, labor ward and postnatal care units, all fully equipped to ensure safe delivery for mothers.
When the condition of the mother is not favorable for normal delivery is when the mother is now taken for cesarean section. Then after cesarean section, the mother is monitored very closely to ensure that she recovers very well from the anesthesia, so that she doesn't develop any other complication.
Nimehudumiwa hapa siku ya jana. Nilikuja nikiwa nataka kujifungua. Kweli hospitali ina huduma mzuri. Kufika nilihudumiwa kwa haraka sana na sister, nikachukuliwa, nikapika picha hapo na hapo, nikashughulikiwa, ndio sasa nimejifungua.
Upon delivery, newborn babies receive neonatal care in this unit, which is fit out with an incubator, standby to neonate, preterm and underweight babies who may require intubation and mechanical ventilation.
Because of Linda Mama, they are really coming in a good number, and we are happy with that. We encourage the government to continue helping our pregnant mothers with the Linda Mama issue.
Nimetumia Linda Mama na ni free charges. Nurses hawana ile wanakupeleka mbio, nurses wanakuhudumia vizuri. Kazi yao ni mzuri. Kila wakati wanatutembelea, watoto wetu wanatuoshea, tunaoga maji moto.
Mother and Child Clinic MCH, where qualified pediatricians and obstetricians journey with mothers and mothers-to-be through antenatal and postnatal stages.
And those who are breastfeeding and children under 5 years.
We have mother and child services, the MCH, where we offer antenatal services and child welfare services. We encourage mothers to start their antenatal clinic at least at 16 weeks, and every child who is born should be brought in to be immunized.
Specialists monitor maternal and child health for at least 5 years after the baby is born, including screening mothers for cervical cancer and administering other key vaccines.
We also do cervical cancer screening to mothers, those who have delivered, those who are pregnant at a certain age, to prevent them from having cervical cancer, and we give them education, and we also encourage them to bring their daughters who are from 10 years to 14 years to get the HPV vaccine. And from there we are getting a good number. Even the schools are calling us to go and immunize their girls between 10 to 14 years against HPV vaccine. Also in the same facility here, department, we also encourage our clients, those who escort their relatives who are sick, those who bring children to the clinic against coronavirus vaccine.
The Mother and Child Health Unit works jointly with the Comprehensive Care Clinic to provide HIV/AIDS testing services and appropriate medication to HIV-positive children and adults, as well as those who are more susceptible to infection.
We offer HIV counseling and testing services for all the clients or our clients who come to Kiminini Cottage. And when I say HIV and testing services, I mean the client do not just walk away with the test result, but they also go home with lots of information. This is because we really tackle so many issues revolving around HIV, such as risk reduction, drug and substance abuse, HIV preventive measures, there's use of PrEP, there's issues of discordancy, and we also do TB screening, STI screening. We find that these issues are just revolving around HIV, and if you do not tackle them well, maybe we will not be able to help the client as it is supposed to be. So, and above all, we also do proper HIV management. We have a clinical team that is so well equipped, and they can really take care of all the patients.
Patients also receive guidance and counseling on social psychological issues.
These services are free, they are youth friendly, and we really maintain client confidentiality. Jijue, jipende na ujilinde.
The hospital has 3 theatres, which include the minor theatre, reproductive health theatre, and the general surgery theatre.
We offer both major and minor surgeries. We have specialists who come in to take care of our clients. We have gynecologists, orthopedic surgeons, we have general doctors, and then we have surgeons who deal with different cases that are brought to our theatres.
In minor theatre, we carry out procedures like circumcision, excision, and suturing of wounds, instead of doing them at the outpatient because of the patient's care. At the second theatre, our reproductive theatre, we do surgeries which come in line with reproductive health, mostly female reproductive health. In the same theatre is where we carry out cesarean sections, we do TAH, we do myomectomies from there, and cystectomies. With qualified doctors and anesthetists. In theatre 3, we carry out surgeries which are major, like thyroidectomy, ORIF, exofixation of plates, and many other surgeries.
All theatres are fully fledged with medical consumables and equipment necessary to perform surgeries on a 24-hour basis.
We have several machines which help during the procedure, and they are reliable. Supplies are always available for the safety of the patient. The surgeries done are always on a subsidized price for all the patients. Reliable machines like an anesthetic machine, which helps us to monitor a patient whether in a general anesthesia or spinal anesthesia.
We stock a variety of essential drugs in our pharmacy with latest information on safety to maximize efficacy.
We don't just pick drugs from any company. We do specific consignments from meds, that is the mission of essential drugs, and they offer quality drugs. We ensure that our drugs are well stored. We have the room temperature thermometer that ensures that our drugs are kept to the maximum and minimum thermometer within the ranges, so that as we give the drugs to the patients, they have efficacy and potency.
The pharmacy is open day and night to sufficiently meet the increasingly dynamic healthcare needs and minimize referrals.
By the time they come to the pharmacy department, we ensure that we do not substitute any prescription from the clinician. So we give whatever we have and whatever has been prescribed. So most of the times, most patients do not go without drugs.
At Kiminini Cottage Hospital, we prioritize patient needs and preferences. Our state-of-art private wing allows you to access quality healthcare with unparalleled comfort and confidentiality.
In private wing, we have 10 rooms. We have 4 rooms with monitors where we manage most sick patients who need close monitoring. And here in private wing, our patient will not feel bored because we have sources of entertainment like free Wi-Fi and even television in each room.
We value our customers and we want their rights upheld, for example, confidentiality. We have qualified staffs who deal with our customers and they maintain the rights of the customers, as well as we look at the rights of our workers. So we look also at quality as one of our values. We want to ensure quality and standards by doing the right things right, the first time and all the time.
Our ambulance services are available for emergency and referral cases.
Whenever one is in need of an ambulance, feel free to call us and we'll dispatch our ambulance to you for service.
The hospital is accredited by the National Health Insurance Fund with provisions available for selected private insurance agencies and corporate schemes as we strive to ensure our services are accessible to all.
This office is the NHIF office, and apart from NHIF, we deal with other insurances also. So I'll start with NHIF. We have different schemes under NHIF. We have the national scheme, we have the civil servant scheme, we also have the national police scheme, we also have EduAfya, and I'll specifically talk about the national scheme. Under the national scheme, we serve clients who are self-employed and also those who are employed in the private sector. The civil servants are the ones who are employed by the government and the county governments. The national police mainly covers for the police officers who come in and walk out without paying a single cent. We also have the EduAfya. EduAfya mainly deals with the students who are in the secondary schools. EduAfya enables the students to walk in and out and access services such as the outpatient services, the optical, the dentals, the surgical, without paying a single cent. Also, NHIF provides for access to surgical packages. Under the surgical, we have the minor surgeries and we also have the major surgeries. If you have NHIF, that means if you are supposed to undergo any surgery, whether the minor or the major, that means you will come to our facility, Kiminini Cottage Mission Hospital, without paying a single cent, and you will be handled by qualified doctors and surgeons.
We are working also towards partnering with other insurance providers to ensure that more clients visit us to access services using those covers. Everyone is welcome to choose Kiminini Cottage Hospital as their outpatient facility so that you utilize these services without paying a single cent. so long as you also contribute your money to the NHIF so that your healthcare needs are catered for by this insurance.
Apart from NHIF, we also have an insurance cover for the teachers, those who are employed by the TSC, and it is called MACAL. This one also covers for inpatient and outpatient services for the teachers. We also have the DEFMIS. This is for the Kenya Defence Forces.
Resident physicians at Kiminini Cottage Hospital work in liaison with consultant medical specialists to ensure patients get holistic, diagnostic and therapeutic care.
We have our specialists who come here. We have surgeons, we have gynecologists, we also have orthopedic surgeons. They come and review the patients. When they feel the patient is fit to go home, then they can recommend.
As a faith-based, Christ-centered institution, we focus on wholesome care. Hence, we have a chaplaincy department that takes care of the spiritual and psychosocial needs of our patients.
We value so many things at Kiminini Cottage Mission Hospital. And these values, we treasure them, and not at one time do we want to lose any of them. Like fear, trust, and acknowledgement of God in all our transactions.
We always have the services on every Thursday before we start to treat our patients. There is always a mass on Thursday before even we begin on treatment. And we approach, our services are mostly approached from the spiritual perspective.
Daniel Mosobo, a resident of Kaptama village in Mount Elgon, attests to the warm reception and swift interventions he received when he first sought medical attention 3 days ago.
Sikuwa na nguvu mwilini, sikuwa naweza kutembea. Nikakutana na rafiki akaniambia anipeleke nije Cottage hapa Kiminini. Nikakuja asubuhi mapema. Nilipofika nilipokelewa vizuri. Nikaekwa under some tests. Nikapatikana siko vizuri sana. Nikalazwa kwa muda wa siku 3 kuanzia hiyo Jumamosi hadi siku ya leo, ambapo nimejisikia poa, nasikia niko na nguvu, nasikia niko fit, nasikia kuenda tu home, nipumzike kidogo, alafu nitarudi shughuli zangu. Kwa wale wenye wajafika huku, feel free kukuja man. Interaction iko poa, manasi wana treat fit, unasikia tu umepona.
We receive patients according to the time that they come. So the computerized system and software shows us the exact time that the patient came, so that we can be able to see the patient on the basis of first come, first serve, so long as it is not an emergency. So there will be no trespassing or any bypassing of any patient.
We have cultivated a friendly culture between patients and staff to strengthen compassion in healthcare.
In outpatient, we have 4 consultation rooms. The 2 are general consultation rooms, and the other 2 are special clinics.
We have qualified doctors, nurses, clinical officers, laboratory personnel, other staff that have left out who serve and maybe people never notice their work in hospitals. People in the kitchen, the catering team. We have a very qualified team who will serve you with the meals that are quality and nutritious.
Patients receive special diets depending on their nutritional deficiencies and health needs to speed up their recuperation.
Here at the kitchen is where all your dietary requirements are well catered for. We also serve the private wing and the general wards, whereby the private wing is a bit special, whereby we serve according to their orders, and the general ward, we just follow our menu, but it is simple and well balanced.
Food imekuwa poa. Nakumbuka kuanzia tu siku ya kwanza. Hiyo sikuwa na appetite, lakini baada ya kukula hiyo food mara ya kwanza nilisikia at least I really liked it.
We continue to reinforce security within and around the hospital premises as we work with our security team and CCTV surveillance to guarantee you high-level security and safety of your belongings.
You are safe wherever you are. So when you are at Kiminini Cottage Hospital, be safe, feel safe, you are secure.
Kiminini Cottage Mission Hospital serves community members from within and beyond, handling referral cases from other health facilities outside Trans Nzoia County.
So I wish to encourage everyone living in Trans Nzoia and in the neighboring counties of Trans Nzoia and in the country at large to access care, to visit us and utilize the services we offer at the facility.
We are strongly devoted to our mission of providing quality, timely, holistic and affordable healthcare in a more sustainable way. For inquiries and emergency cases, contact us on 0723 644 555 or email us on kimininihospital@yahoo.co.uk. Follow us on Facebook at Kiminini Cottage Hospital, or visit our website at www.kimininicottagehospital.com.
I would advise any patient or any client who is seeking medical services and medicines at large to Kiminini Cottage.
Visit Kiminini Cottage because number one, the staffs here are well trained and they can really manage the clients well. Number two, there is confidentiality. That is very key. Most of the clients do really want their issues to be confidential, and that we really do well.
We embrace universal health care and we care about humanity.
In the long run, our main goal is to ensure that the patient is okay. The patient is not in pain. The patient, we restore the smile in them.
At Kiminini Cottage, we treat and God heals.
Welcome to Kiminini Cottage Mission Hospital and enjoy our timely, patient-centered and high-quality healthcare services that guarantee you value for money. Kiminini Cottage Mission Hospital, we treat, God heals.